Welcome to the Confidence Through Health podcast. My name is Jerry Snyder. As a health, wellness, and sports performance coach, my goal each week is to bring you experts to help you take control of your health and build your self-confidence. Thanks for including me today on your journey to better health. As an elite level runner and coach, I'm excited to introduce you to the All In Running Club. The All In Running Club exists to help you become a better runner. Whether you're a beginner, an elite runner, or anywhere in between, the mission of the All In Running Club is to give you the tools you need to find your success in running. Join today to take advantage of the 75% off yearly membership rate offer. Click the link below in the show notes to learn more. So thank you, Anne, for being a guest on the Confidence Through Health podcast.
Thanks for having me, Jerry.
So as a physical therapist, it's something that I'm passionate about is helping people, because I don't think people, I've had several physical therapists on over the episodes, and I think it's the reason I keep coming back to it is because so many people think of it as sort of like, the old gym class of like, oh, I hate going to that. I don't want to do that. And it's like, they don't look at it from the standpoint of like, this is something that's hugely beneficial to me in trying to keep my body mobile and active and pain-free. But with all of that, like, why did you get into, what was your motivation to say, I want to be a physical therapist and I want to help people in this way?
Sure. I saw it firsthand in my own family. Any healthcare providers that are listening will know what Guillain-Barré is. So it's a neurological disease that basically results in a progressive demyelination of the nerves, where you lose all function in your body. And my uncle was diagnosed with that when I was a kid. And so I was able to see his full recovery. That's the amazing thing about that disease, is that many patients do get a full recovery. And he really attributes his journey back to health to his physical therapy team. And as a kid, we would go into the skilled nursing facility and bring him lunch, and we'd always catch the tail end of his gait training in the parallel bars. And so I was introduced from a really young age. My dad, the other piece of it is that my dad is a construction worker. He has a high school education, has never really known anything about anatomy or his body. And he suffered a pretty severe back injury. And he still does his physical therapy exercises that he had to do in therapy, and just would come home from every session saying, hey, do you know what the hamstring is? And, just, he was really empowered by that, for somebody that just didn't have that education, to be able to teach them about their bodies. So I thought that was really cool to be able to be in a field where you can really help somebody find their journey back to health.
Well, and that's really like a big piece of physical therapy is a lot of people think that it's either for athletes or it's for people to get hurt on the job. Right. It's like one of those two things. Otherwise, oh, it's not really something I need. Or the doctor may suggest like, oh, you should probably go. And they go, I can live with it. But how much of a problem is it when we decide to just live with the pain?
Yeah, I mean, when you have some sort of a chronic issue, it changes the way that your body moves, right? So if you have a chronic Achilles issue, right, like we were just talking about, that's going to alter your gait for your walking and for your running or whatever activity you're doing. And over time, you really don't realize these small compensations that happen and the weakness that can really happen on that entire side of the body, not just in that particular area where you're experiencing the pain, but it also alters the body mechanics through the whole chain of your body from your pelvis up and down. And so really, the great thing about the physical therapy field is we now have direct access in some form in every state in the United States. And so what that does is that allows patients, people in the community to seek physical therapy first. You can get an evaluation and some form of treatment in every state, and that varies by state. But it's a really great way to just say, hey, I don't know if I necessarily need to continue with a treatment plan or care, but this thing has been bothering me for a while. And so to be able to get some professional healthcare advice, without needing a physician referral, is a great way that we can service our communities.
Right. And that's, like you mentioned something that's so true. And as a runner and an athlete, I see it all the time in myself, not just in the people that I work with, but like you have that the pain starts to show up somewhere, and then you go, oh wait, but is this pain really from this, or is it from an injury on the other side? And like I'm compensating, which is causing the pain that I feel. but it's really because I've got a weak link somewhere else, or a nerve issue, something that's not working properly. And I might not see it myself. But if I go to a therapist who's trained in understanding of what's going to happen, they're going to see that and go, oh, hey, here's the real issue.
Right, exactly.
And so that's a huge piece of like why you would want to go to a physical therapist, um, in my opinion, first, before you go to the doctor, and if you can get in to see somebody, because they're going to be able to tell you those things versus sometimes the doctor may just say, well, that's your pain, where your pain is. Let's take an x-ray of that and not see anything and go, oh, well, here's some pain med, like take this and be done.
Sure. And I think that's the exciting thing about the field of physical therapy is that we're movement experts.
Right.
The doctors in the urgent care and in the ER, their job is to really be able to triage, is this urgent? Is this emergent? And if it's not emergent, they're gonna send it out. They're not
Right.
gonna get into all of the nitty-gritty of exactly what's going on with movement. Now they may or may not have somebody move through range of motion and do some muscle testing, but that's not really what their job is. Their
Right.
job is to see if you have a true medical emergency. And the majority of musculoskeletal issues are not that. And
Yeah.
so that's where we can come in and really be able to assess, is your ankle issue strictly coming from your foot and ankle, or is that something that's more radicular coming from your spine, right?
Right.
Where's that exactly coming from?
Right. And that's where, like, I would say probably everybody that's listening has had that moment where they wake up in the morning and they're like, oh, I slept wrong, right? And you feel that creak and crack and the tight muscles, the neck sore, can't move it one side or the other. Like that could be a sign of that thing is wrong, or it could be a sign of something else. Like you really did sleep wrong in positioning and you threw your hips off. And those are all things that really, they're not emergent, like you said, but they're things that could turn into emergent issues later on in life if you don't deal with them.
Sure. Right. And I think the other piece of this is having a physical therapist that you know and trust in your community, and you can go to for those little issues, because a lot of us, especially if you're somebody who does tend to move your body a lot, you're a runner, you're a swimmer, you're a cyclist, you might wake up with that pain and just say, it'll work itself out.
Right.
But knowing if that doesn't go away in a couple of days and it doesn't work itself out, you would hopefully have somebody that you can go to ask that professional advice and give you an assessment. Sometimes with those patients that I've seen for a long time, they might shoot me an email and decide, hey, come in tomorrow, let me see you real quick. And
Mhm.
it might just be a few stretches or some strengthening that they can add into their routine. It doesn't always have to be a full plan of care for
Right.
some of those more, more chronic issues or things that just pop up, but being able to get that medical advice on,
Yeah.
is this something we need to work toward for a long time? Or is this something that can be a quick one and done? And that's okay too.
Yeah.
It's really exciting as well, just all the technology that's coming out with telehealth options and things like that. There's a lot of opportunity to be able to communicate with a healthcare professional remotely as well.
Well, and one of the things that I really enjoy is that, like you said, is sometimes it is just a one and done. And I think a lot of people that haven't been, or maybe haven't been in a long time, to a physical therapist, like you said, the technology's like so different now, than 15, 20, 25 years ago. And like it really can be potentially just we just need to like tweak this little thing and boom, and you're done. And like I know when I have a little muscle issue, and a lot of times my physical therapist will be like, just come in, we'll put a needle in it, we'll make it go away, 2, 3 days, you're gonna feel fine. And I'm just like, really? As opposed to like, here's your stretching routine you have to do every day, 3 times a day for the next 3 weeks. Come see me every day. Like, I mean, sometimes those things are needed, but a lot of times it's the technology and the education has gotten so fine tuned, I think, that it a lot of times is a lot faster than people think.
Right. And it depends, we have to meet our patients where they're at. So
Right.
if I'm working with a high level athlete that already has a movement protocol that they're working through, they're training for a marathon or some other athletic event, I know that they're putting in a lot of time and energy. And so I might not see them as often, but I'm
Mhm.
going to be in communication with them a lot and make sure that they're, tweaking their routine a little bit.
Right.
But any sort of a especially a patient who's not moving their body as much, we need to get them in consistently to be able to see that muscle adaptation and change over time, because that does take time. So
Yeah.
that's one of my joys, is being able to figure out, well, what type of movement do you like if you're not somebody that moves? Not everybody wants to run a mile.
Right.
And a lot of patients don't want to go to the gym for one reason or another. So really figuring out what their why is, what do they want to be able to do physically, and then how can we help them to do that?
Yeah. Well, and really, because what it boils down to is that, like, later in life, if you don't take care of your muscles and your structure of your body, like, the balance issues that are created later in life are sometimes like fatal, if you or at least like life altering for somebody that, breaks their hip and has not been exercising or working or, doing things with their muscles. Their body doesn't know how to recover from that, right?
Right. And some of that is just keeping a good baseline strength. Every patient over the age of 65, we are balance screening to some degree. And if their balance is shown to be poor, based on some of our objective measures, then we include that in our plan of care, and we make sure that we have that, not necessarily for them to be, doing any sort of heavy yard work or walking on uneven surfaces, but being able to walk out onto their sidewalk, go down a step, get to their mailbox and back,
Right.
and feel comfortable doing that.
Right. Yeah. And I recently started working with a doctor who's wanting to lose weight, and he's early 70s, and he doesn't want to retire. He wants to keep going, and like his mind is still sharp. Um, but he was shocked the first time that we did anything. I was like, we're just talking about balance, like, and like, he couldn't, he does have weight that he has to lose, of course, but he couldn't like move his torso over his feet without like completely about to just completely fall over. And I was like, no, this is not good. Like, we have to go some basics. And I think a lot of people don't understand that, like, if they don't address those little issues happen here and there, a little muscle pull, like you said, it's like, oh, I'll just deal with it and it'll work itself out in a couple of days. But if it doesn't, if they don't do something about it, like, that all piles up over time.
And as we age, our balance is decreasing anyways,
Right.
because the balance system is vestibular, which is your inner ear, it's your muscle structure and strength, and it's your sensation. And as we age, all the composition of all those things changes. And so, the one of the easiest things is to keep yourself strong, which isn't easy because
Right.
people have to move to do that.
Yeah.
And in order to, really challenge our vestibular system and our neural input, we have to challenge it in order to make it better. And if someone's had a fall, that's really scary to do.
Yeah.
Their world, once they've had a fall or even just some sort of instability, gets a lot smaller. They don't move as big, they don't move as far.
Right.
And there's a lot of really simple ways to improve that. Brush your teeth with your feet together. You're right by the counter. Brush your teeth on, standing on one foot. A lot of different things that you can do that are small little activities throughout the day to make that better.
Right. And then and speaking to that too, is like, a lot of people think it, which can be the case at sometimes, is like, if I go to a physical therapist, I'm going to be like working really hard. They're going to make me really tired. I'm going to be sore. But sometimes it's not, because it's like, okay, we've got to just do these basic balance things and these basic retraining of, muscular structure to be able to hold yourself in the proper position before we then build any muscle to it. Correct?
Right. We work really hard to dispel that myth when we evaluate a patient.
Yeah.
I think if someone hasn't had exposure to physical therapy and it's only been through maybe film or media, they see someone with a gait belt walking with a walker or a cane,
Yep.
and they probably see someone stretching someone's hamstring, right? Like
Right.
that's what a lot of people think physical therapy is.
Yep.
But it's so much more than that. It's saying what kind of movement is it that you want to do, and let's be really specific to that activity. So if you want to be able to, carry your groceries, well, then we need to do some, unilateral strengthening of your core. We need to do some unilateral lifting. I don't need that patient to be doing a million clamshells or bridges, right? A lot of us know those exercises.
Right.
Now maybe that's helpful to build strength, right? But we need to somehow get to the specific function of what that patient wants to do,
Yeah.
and then get them to the point where they can treat themselves. So when
Right.
that issue creeps up again, that comes back to the chronic stuff we were talking about. Someone's got a chronic issue, I want them first to say, hey, I'm going to go back to my home exercise program. The last time I saw Ann,
Mhm.
I'm going to try to do those exercises. And if that doesn't work, then it's probably gone beyond the point where I can treat myself, and I'm going to go back
Right.
in.
Right. And that's a big piece of it, is it like to remember those things and like keep that, and like, and whether it's like you said with your dad, whether it's like, okay, I'm going to keep this for my lifelong routine and just do it all the time, or when something pops up, oh, let me just go right back to that versus letting it sit for a couple of days. Um, as an athlete myself, I mean, I know that because it's like if I forget my warm up, or the proper warm up, or let's say, well, I mean, like in the past couple of days in Texas, it's been so cold. And so the warm up's been extra, right? To make
Right.
sure that I get, there properly. Um, but I know if I forget one of those things, like it could potentially start to unravel in the next day or two. And so like, and that's a big, huge piece of somebody who's exercising, whether they're a full-time, athlete, or a weekend warrior, but somebody who likes to do the athletic stuff and is involved in that stuff, that warm up and that post activity piece are hugely important to keeping yourself injury free, correct?
Right. Absolutely. Yeah. I mean, especially with, it will take running, as one of the most repetitive activity is running and
Yeah,
cycling, right? There's not a lot of things that are going on in that frontal plane side to
right.
side. It's all forward, not
Yep.
even backwards, it's all forward.
Yep.
So with such a repetitive task, you do need to make sure that you're warming up. And then not necessarily a specific cool down, but something that's going to help things continue to move, keep moving your
Mhm.
limbs. If you've ever run a race and I will never forget the first marathon I ran. Had a good race, felt really good, and then I got in the car and I drove 3 hours.
Oh gosh,
Right, exactly. I
I
mean,
could
that
just
was really
imagine.
dumb.
Oh wow.
Now, a few races in, I know that was a terrible decision, and I know I should never do that.
Yeah.
Never get on a plane or drive the day or the day after. Give
Hmm.
yourself a couple days.
Right.
Um, but my body got really stiff. Now, after you've run a long race or done an activity for a long time, that's the last thing you want to do is be on your
Yeah.
feet. But getting in a pool, doing something that you can keep your muscles moving is going to be so much better for your recovery.
Yeah. It's funny you mentioned getting on a plane, because I did that myself. Well, I guess it's 2 years ago now. I ran a race in Atlanta, and the race was in the morning, and I had scheduled a flight in the evening. And I was like, ran the race, went back to the hotel, showered, changed, got home, or like got in the car, went to the airport, and then the flight got delayed. And so I sat in the airport for like 2 extra hours, and then sat on a plane, and then had to drive an hour and a half once I got back to the airport to home. And so it was a lot longer time period sitting on the same day and it was only a 5K, but still it was like, and I had an injury come up, a hamstring, that just like, because in the airplane the hamstring got started getting tight, and I'm like, I can't do anything about this. Like I can't really stretch. There's no place to really do anything. And so it just got tighter and tighter. And that probably took me, gosh, that was probably a 3 or 4 month ordeal to try and finally get it to relax and be like, okay, you're normal again.
Right.
And so like, yeah, those post decisions are huge. Even though they might not seem like it, it's a really big decision to like, don't squeeze all your exercise into just a short little time period. Make sure you have something afterwards to just let your body come back to a baseline before you completely like stall out to nothing, right?
Right. And with the non-athletic population or somebody who has more of a like labor heavy job,
Mhm.
we see injured workers all the time that have repetitive jobs and very, very similar. What do you want to do after a long, hard day at work? You want to sit on the couch. Well,
Right.
that's that's valid. But maybe we can incorporate a little bit of stretching and movement while you're chilling out watching TV on the floor,
Right.
to move in a way that your body hasn't been moving all day, right? So for running, if everything is forward, can we do some sort of like rotational stretches or side bending, things like that are challenging and stretching the muscles in different ways, to kind of get out of that repetitive motion.
Right. Um, and then like, let's say you do have, a tweak, not every tweak, like muscle pull, or like you slightly roll your ankle or something like that. Like not everything is automatically, I have to go to the physical therapist, right? Like sometimes it's like, okay, I can do the at-home treatment in, the old standard ice, rest, elevation, like, but then at what point is it like, is it okay, the limping's there, the pain is there? At what point would it be like, okay, this is more than just a little tweak?
Sure. I think at the first time that someone has a tweak, I would encourage them to reach out to a physical therapist, even if it is just right away. And,
Yeah.
we work really hard, I know at ATI, on access to care.
Mhm.
And, maybe that's a telehealth visit, maybe that's coming into the clinic the next day. But again, we can get patients in pretty quickly. So to be able to just assess and see what kind of an issue is this, and
Right.
give some tips to get through that little tweak, and then again make that decision on, does this need long-term care for,
Right.
a 6 or 8 week plan of care,
Okay.
or is this simply, let's wait it out kind of an injury.
Right.
It totally depends on what the tweak is.
Yeah. And
And
of course,
the
what they
person's
want to do.
history, right? And the person's like movement
Yeah.
history and what they've been doing.
Right. Right. Um, and then like from a let's take it to the like to the back to the like you go to see your doctor, and you didn't think, or you don't have context with the physical therapist, and so it's like, okay, well, I need to start with my doctor and have them recommend somebody. But if you go to your doctor and you've got something that is more of a muscle pain, or a nerve that like is acting up when you move a certain way, those movement related injuries, and your doctor doesn't suggest physical therapy but says, okay, take this medication, or let's just wait it out, like, is that should be a big red flag, right? That we should be like, okay, wait a minute, something's wrong here.
Absolutely. If it's clearly linked to movement, I would encourage patients and people to advocate for themselves that
Mhm.
I want to try some physical therapy. Because again, that muscle tweak it's going to be painful, right?
Right.
Maybe let's say it's a neck injury, right? Maybe it's causing some pain down that side of the arm. And the doctor says, hey, take this medication for the nerve pain. Well, that's really helpful for the patient that has really high symptoms, right? The
Right.
patient who's really irritable, who's got an 8 out of 10 pain. And so that makes them feel better, which is really important.
Sure.
And also we need to make sure that that person is getting out of that, whatever that new movement pattern is,
Mhm.
right? So if
Right.
they're side bent, they've got their head to the side and their shoulder up by their ear, you know, that's going to create tightness on one side, weakness on both probably. And so then that does become a greater musculoskeletal issue and a postural
Right.
issue that could turn chronic,
Right.
versus, the doctor potentially prescribing something and doing that concurrently with physical therapy.
Yeah.
I would really recommend people be advocating for themselves. And unfortunately, with our healthcare system, we have to do that, and we have to teach people how to do that.
Right. And that's one of the things that I love about seeing my physical therapist, versus seeing my doctor, which, and nothing against my doctor, but you mentioned the healthcare system, like a lot of times they have 7 minutes, right? Or like they have a very short window to spend with you. And but when you go to physical therapy, it's like you've got, you know, a lot of times an hour
Mhm.
of, and it may be, okay, well, okay, do this exercise, start doing this, and then you go over and you're starting to put notes in your, computer, and you're watching things. It may not be an hour of communication, but that door is open a lot more. And I think that another thing that people don't understand is that, like, most physical therapists nowadays are doctors. Like, they've gone through and gotten their doctor of physical therapy, and so the knowledge base is far greater than, I would say, even 10 years ago, but definitely what I would think of back in like the 80s and 90s when I first started to go to physical therapy for my, athletic career.
Right. To comment on the 7 minutes with patients,
Yeah.
again, it's similar, even if it's a primary care doctor, they don't have a lot of time. And
Yeah.
their job is to see what kind of an issue this is. And, hopefully for musculoskeletal issues, they're sending to physical therapy. And if not, the patient's advocating for themselves. And once physical therapy is started, that doctor is, let's talk chronic low back pain, and that doctor
Mhm.
might be hands off.
Right.
And so, they don't necessarily go into all of the details about, well, tell me about, the initial injury, let's say, was years ago from a lifting injury, and then it's
Mhm.
kind of crept up throughout the years, and then they had another lifting injury, and so the doctor's like, go learn how to lift.
Yeah.
But then we find out that this patient has a factory job. And so not only do they have a lifting injury, but at work all day, they're rotating and twisting a lot, right?
Right.
So we can get all of that information from people because, like you said, we have a lot of time with our patients. So we can
Mhm.
really get to understand what their home life is like, what their work life is like, and how they move throughout their whole day, not just when they happen
Right.
to feel the injury.
Right. Um, and like y'all could also be saying, okay, well, we need to add some medication to this piece, right? It's not just I have to go to my primary to get that piece of it. It's like you can also be saying, okay, well, we need to be looking at a pharmaceutical to come along and help along the process, speed it up a little bit.
Sure. I mean, as part of the doctorate, we know how physical therapists know how to screen out for red flags. So if
Mhm.
that person is coming to us before seeing their physician, we're using the PT first model, and they're coming to see me, I know what red flags to screen out for low back pain. And if it
Mhm.
is something that I'm concerned about, I will send them to urgent care ER, their primary care physician, depending on what's going on. If I identify that this is a musculoskeletal issue that I believe physical therapy can help with, I expect some sort of change within 6 visits.
Right.
And if I don't have that change, then I am looping in another healthcare provider,
Mhm.
right? If it's a really complex musculoskeletal issue, I'm going to be collaborating with other physical therapists that I know in the field,
Right.
and be able to say, hey, is this something I should send out? Or maybe it's something that I just, the patient has just been so symptomatic, we haven't been able to touch it no matter what we try. Absolutely,
Right.
we're going to send out. And I think that's a really important piece to know about the profession, just how we have evolved.
Mhm.
To be able to help and screen patients better, again, so that
Right.
the physicians are spending their time on the patients that they really need to be treating.
Right.
There's a big push right now in healthcare to get physical therapists into the ER,
Mm.
to be able to help screen some of those out. So there's a lot of health systems across the country that is utilizing physical therapy as part of their
Oh, wow.
triaging. And that's great because
Yeah.
then the physicians can spend their time on the patients with different needs.
Right. No, I think that's great. And so I got that Brett brought up two things. One, but is like, when you think about a physician, say a primary care, you've got an issue, you call up and you say, I need to see them, and you go in and like typically, okay, you'll see the nurse who does your vitals and your initial, and then the doctor will come in and give his opinion, and then you're typically sent with whatever orders they want you to go do. But when you go to physical therapy, at least the experiences that I've had, and so I'm assuming it's everywhere because I've had this at multiple clinics, is like, yes, you have there's an individual room if you need to go in and see it and like do stuff behind closed doors. But a lot of times you're out in the open and there's like 5 or 6 other patients or maybe more who are all going through their exercises and using the different equipment, which means there's 5 or 6 other physical therapists. And from what I observe is like all the therapists are sort of watching everybody a little bit, and I always hear somebody go, hey, he's doing that wrong. Like, and so you're getting multiple opinions, not just like you said, or I'll pull other people in, but you're getting multiple opinions on the spot of, hey, oh, have you tried this? Have you done this? And it's not in a way that I think it's that collaborative team effort. It's not in a way of like I'm trying to show you that I'm a better physical therapist than the one you're seeing, but it's that collaborative, like, oh, let's get them healthy. Let's all work together
And I think that's just another huge plus for physical therapy and going into that for the benefit of those movement issues, as opposed to just taking a medication or just trying to just, do it at home on your own and hoping it'll go away.
Right. And there's two pieces to that came up for me when you said that. So, we are, especially at ATI, we really value team-based care. That's a huge part of why we're so successful with our patients. And, in some ways I like to compare it to the medical model, where you have the physician, you have the PA, you have the nurse practitioners and the MAs, and all of those people work together to get your care accomplished. And
Yeah.
we're doing the same thing in physical therapy with our physical therapists, with our physical therapy assistants, with our rehab techs. And there's a lot of people on the floor to be able to help patients to move better, more efficiently, get stronger. And so I love that. It's one of the big reasons why I love working in outpatient physical therapy. And then the other piece that you mentioned is there are often many patients in the gym. And so often, a patient will be exercising, they'll look to their left and they'll say, "Hey, aren't you my neighbor?" Or "Aren't you, how's your son doing in college?" And there's just this really great community feel and camaraderie. And, they start to talk about their injuries with each other. And, are you doing clamshells? I'm doing clamshells, just kind of comparing their therapy journey. So it creates really good energy and a good vibe in the clinic, because it isn't saying, like you said about correcting exercises. I wasn't working with you specifically today. You're not on my schedule, but I noticed that you could be doing this a little bit better. So I'm gonna call it out.
Right. And that's all part of the getting better, especially in a movement based, because there's certain things, there's certain movements that really do need to be done in a certain way from a body structure standpoint. Otherwise, you're going to potentially create more injuries down the road if you don't do them right. And having that correct person, and not relying on, if you're a lifter and you go to the gym, not just relying on the person who has built up a big muscular body to say, "Oh, I know how to do it correctly," but actually going to a physical therapist and saying, like, "Oh, this is how you should be lifting. This is your form when you're doing this type of lift or that type of lift," and getting it correct. Because again, that it's all about that down the road. What's going to happen down the road when you're 20, 30, 40 years from now, setting yourself up for that healthy body that's going to react properly and recover quicker.
Yeah, absolutely.
So, is there something besides warming up that we should be doing to help prevent injuries?
Think we need to think about what kind of movement are you doing currently, and what kind of movement do you want to be doing? And then make sure that you have the muscle support and mobility around those specific joints to be able to support that activity. So I think it's highly individualized. Does every patient need a warm up? Not necessarily, before doing an activity. No, but if you're a runner and you're going to do a speed workout, you probably should warm up, right? So I think it is highly specific to whatever activity someone's doing. Again, with work injuries, right? Repetitive work injuries, a lot of workplaces have started to implement stretching routines in the morning, right? The whole crew does a 10-minute little stretching routine. And that's great, because those are repetitive jobs. Not every job needs that. But thinking about people with a desk job, they need to be taking some stretch breaks so that they're not leaned over on their computer all day. So not as much of a warm up, but just some sort of movement throughout the day.
Just to not get stuck in, and it's very true that, like, you could be somebody who exercises a lot, and so you look fit, you look in shape, but if you go and I think probably a lot of runners experience this, if all you do is run, and then you go play a pickup game of basketball or football or some other sport, and all of a sudden you're like, because of the lateral movement, you're like, "Oh my gosh, all these muscles are sore. What is going on? Like, I thought I was fit and in shape." But it's that difference of movement and style that changes how the muscles have to work, right?
Right. And you are in shape for your activity, right? You are in shape
Right.
for running.
Right.
You weren't in shape for basketball. And
Right.
so now if that's a goal or if that's a form of cross training that you want to do, great. Because now you're working your upper body, which we
Right.
don't do as runners hardly ever,
Yep.
right? Now
Yep.
you're moving side to side, you're jumping more.
Right.
So
Yeah. So it's getting that whole, and that's, I think, why it's great to have an individual thing that you really prefer and love, and from an exercise standpoint, from a long-term health standpoint, but not getting so siloed into it that you don't do other movements and other things, um, to create that overall healthy environment for your body, right?
right, because with anything that's repetitive, you do increase your risk for injury.
Mhm.
But that's why for runners, if you if you Google running exercises, right, you're gonna see a lot of stuff with lateral hip stability. You're gonna
Right.
see, your fire hydrants, your side lunges, things like that, which are movements that you don't do during a run, but those
Right.
are muscles that support your pelvis while you're running and are really important. So the best runners are strengthening all of those muscles that help
Yeah.
to kind of support your whole lower body.
Right. Um, so it's been great, and I think it's some great information. Is there anything that we haven't touched on that you're seeing more common, not necessarily athlete, but just like that, like this is something that's pretty common that people need to be aware that, like, if they have these kind of symptoms or anything, is like they probably could come in and get help with physical therapy.
Yeah, I think the call out is probably low back pain. Since the pandemic, a lot of people are working from home now, and
Mhm.
we've always seen a lot of people with low back pain and in physical therapy. That hasn't changed, has definitely not
Right.
gotten better since the
Yeah.
pandemic. And so, there's just so many people working from home now. And, before, when you worked in an office, you would sit at your desk, but then you would get up and chat with colleagues, or you would
Right.
walk down the hall to go to the bathroom. And so that movement, your steps per day, your movement throughout the day has just changed. And so um it's by far the biggest thing that we see diagnosis wise in physical therapy is low
Mhm.
back pain. And somebody that has low back pain is very, very likely to have it for a long time. So
Yeah.
once that starts to creep up, even if you're in your 20s or 30s as you're starting your career, I would just recommend going in and getting an assessment from a physical therapist to look at your core strength, your hip strength,
Right.
your posture, and come up with some sort of a routine. If that's going to be your career is working from a desk, we'll find some things that will help to support your posture, your ergonomics, your spine,
Right.
so that you can kind of set yourself up for success versus having these injuries, that not necessarily injuries, but aches and pains that keep coming back.
Right.
I would really encourage people with those types of issues to seek out some physical therapy.
And you mentioned core strength, which is I think the the biggest piece for people to understand, like, what that means, because core strength is not just I have a six pack or not, right?
It definitely is not. Yeah, I mean, your core consists of your diaphragm at the top, your
Mhm.
pelvic floor on the bottom, and your abdominals and multifidi, which are muscles in your low back. And so
Yeah.
those deep abdominal muscles, I like to describe it kind of like a corset.
Mhm.
So they're internal. The muscle fibers run side to side versus the six pack muscles run up and down.
Right.
And those muscles give you a lot of the support for your low back and your pelvis. Really important for allowing you to sit up and stand up straight. Now, there's no perfect posture, so
Right.
nobody should ever tell you like this is the posture you need to maintain. But you do need to have some core strength to be able to maintain whatever position you're in,
Mhm.
without um, creating some sort of an issue in another part of the body or just
Right.
stressing your low back.
Right. Well, and I think you can tell the difference, because if somebody that has core strength, like you said, there's not necessarily a perfect posture, but their posture will stay in that position longer, versus somebody who doesn't have that core strength. If they're sitting at a desk, they just get creep closer and closer and closer to the computer, and it's not just their neck, it's like their whole torso just starts to like fold in, because they don't have the core strength. And then that's where you feel it, obviously, is your back, because that's what's being stretched, right? Your abs are crunching in, And so they're not really getting extended or flexed out. And it's that those back muscles are just getting stretched and stretched and stretched at that constant. And that's what's in a nutshell, that's what's causing a lot of that pain, right?
Right. Yep. It's just, again, not moving.
Yeah.
And so for my patients that started working from home and noticed some of these issues, I would talk to them about, what are the funds of your HR department, for instance? Like, can they get somebody out to do an ergonomic assessment of your home office? If that's not possible, will they help to fund a high-low desk or laptop, some sort of
Right.
computer support so you can stand for part of your day?
Right.
Do you have, right? So some HSA funds will allow you to buy exercise equipment. So can you get can you get a walking pad if you have to be on your computer all day? There's those little bicycles that you can put underneath your
Oh,
desk
yep.
too. So, is there a way that you can just move your body a little bit through the day? And that's gonna help keep your muscles mobile and your core strong, and prevent just that static position.
Right. And so not thinking of it necessarily as is movement, which yes, exercise helps with fat burn and weight control and all of those things, but not just thinking of it as exercise for those reasons, but thinking of it as movement for basic muscle strength and ability and flexibility and again that long term, like I'm going to be able to recover quicker from things when I'm 20, 30, 40 years down the road, which I think is something that a lot of people don't necessarily think about in the moment when they're in their 30s, 40s, early 50s. But then as they start to creep up, they go, oh man, it's taking me. I mean, because I know I've heard this so many times. It takes me so much longer to recover from these little injuries, and I'm like, why? Like if you're doing things properly, it should stay like the recovery time should stay the same or increase like and get faster because technology is helping get things faster. Like
Right.
it shouldn't take you longer to recover from these things if you're prepared ahead of time.
Yep. And it just always, for me, it always comes down to movement. So, if those modifications aren't helpful or you can't, you don't have the funds to do that, making sure you schedule breaks through your day,
Yeah.
multiple short walks throughout the day may be better for you, or maybe may feel more attainable to do 10-minute walks versus walking 2 or 3 miles at one time. Maybe you don't have the stamina for that.
Yeah.
But again, just movement is totally key.
Cool. So tell us about ATI. In like I know y'all are pretty spread out as far as like locations. Like how can somebody who's maybe thinking like, okay, probably I need to get in and have somebody look at this issue that I've got that's been hanging around way too long. Like how can they make those connections?
Sure. So ATI Physical Therapy is the largest outpatient physical therapy company under one brand in the country. We have over 900 clinics in 24 states, and we also have a really wide telehealth platform. So you can go to our website, you can use the clinic location finder, you put in your zip code, it'll give you the locations that are closest to you. And it's that simple to make a phone call and get on our schedule. We also, like I said, have a great telehealth platform. If getting to the clinic is difficult or, the times don't work out for you for some reason in your area, we have a lot of different ways to provide great access to care.
Cool.
For patients.
Awesome. And I'll link that in the website address in the show notes so people can get to it really quickly. And hopefully find the help that they need when they have that issue pop up or the one that they've been ignoring for so long. So
Perfect.
So thank you. So is there anything that you would tell somebody who is in that situation of like, I think I might have something? Is there anything that's like besides like call us, like is there any sort of like words of wisdom for somebody who's dealing with something or maybe it's just that chronic thing that they can't seem to figure out how to overcome?
Yeah, I think just don't be afraid to ask for help. That's why we're here. Most of us get into this profession because we want to help people. And so, it does no harm to be able to come in, and maybe you don't have a big deal issue. Maybe it's something small, but we can give you some of that education about your body, about movement, about maybe pain science, how to work through some of those discomforts. So don't be afraid to ask for help.
That's awesome. Well, thank you so much, Ann. It's been a great conversation.
Thanks so much, Jerry.
Thanks for checking out the Confidence Through Health podcast. Please subscribe, post a review, share this episode with those you love who need a little extra help with their health journey. Visit allinhealthandwellness.com to learn more about the coaching programs that I provide. All episodes are produced by the Social Media Cowboys, your source for all online marketing needs. Go to socialmediacowboys.com for more information.